Cancer is one of the deadliest, if not the most deadly disease in the world today. Cancer is no respecter of age as it affects both young and old, male and female. Breast cancer has been defined as a disease that is characterized by the abnormal growth of cells in the breast. Breast cancer is the most common cancer in women. Although men also suffer from breast cancer, they only account for 1% of all breast cancer cases, while 1 in every 8 women in the United States get affected with breast cancer during their lifetime. World Health Organization in 2020 recorded 2.26 billion cases of breast cancer all over the world. According to the American Cancer Society, there are different types of cancer, but these 7 are the most common of the types. Now we have the angiosarcoma of the breast, the ductal carcinoma in situ, the inflammatory breast cancer, invasive breast cancer, Paget disease of the breast, Phyllodes tumor, triple negative breast cancer. There are various risk factors associated with breast cancer, and these are some of the common risk factors. Alcohol. The excessive intake or consumption of alcohol may increase the risk of having breast cancer. Gender. Women are naturally at risk of having breast cancer. This is, however, not to say that men are also not at risk of having breast cancer. It is just rare in the cases of men. Personal or family history of breast cancer. If you have once treated breast cancer in one breast, you're at a higher risk of developing cancer in the other breast. Also, if you have a family history of breast cancer, you're also at a risk of developing breast cancer. This explains that if any of your parents have been diagnosed of breast cancer, especially at a young age, you're at a risk of developing breast cancer. If you begin your period at a younger age, your risk of having breast cancer is increased. Also, beginning your menopause at an older age increases your risk of breast cancer. It should also be noted that women who give birth to their first child after the age of 30 may have an increased risk of breast cancer. Also, women who have never been pregnant may have an increased risk of breast cancer. Overweight or obese. Numerous studies have shown that high level of insulin and insulin-like factors in response to obesity have the ability to stimulate the growth of cancer cells in women. Pregnancy. Numerous studies have shown that when a woman gives birth to her first child at an older age, she's at an increased risk of developing breast cancer. Smokers. Female smokers are at an increased risk of developing breast cancer, especially when the women are postmenopausal and prenatal. Not only are smokers at risk, women in the postmenopausal and prenatal category who are exposed to second-hand smoke are also at risk. So, when next you find yourself sitting next to a smoker, you just might want to get up and run for your dear life. One should always pay adequate attention to the various signs and symptoms of breast cancer. Now, here are some of the signs and symptoms. A breast lump or thickening that feels different around the tissue. A change in the size, appearance, or shape of the breast can be a symptom of breast cancer. A newly inverted nipple. Peeling, scaling, crusting, or flaking of the pigmented area of the skin surrounding the nipple or breast skin. Redness or pitting of the skin over your breast, like the skin of an orange.
For more content like this, kindly follow us on Facebook, Instagram, TikTok, and YouTube at Asiwaju Elegboogi.